Hello, I'm Tom Fiala in private practice in Orlando, Florida. On behalf of my co-authors, Dr. Robert Singer and Jim Fernau, thank you for selecting our paper as an editor's choice. This paper, Evaluation of the Post-COVID Patient Prior to Elective Plastic Surgery, was an outgrowth of the work we did on the COVID Task Force for the Aesthetic Society. So a big thank you also goes to Society past president, Dr. Lund, for starting that initiative and for assembling the team. We've been asked a couple of questions about our paper. Number one, what is the most important development reflected in your study? Well, it's that even a mild case of COVID, one that was treated as an outpatient, significantly impacts the anesthesia risks our patients face, and that these multi-system impacts take time to resolve. Our literature review suggested a 7 to 8 week delay time after mild COVID prior to general anesthesia, and that was the most appropriate. Patients who required hospitalization require an even longer delay before they should be considered candidates for any elective procedure, if at all. And they will certainly require a more detailed workup with pre-op clearances. Question 2, what advice would you give to a colleague or trainee who wants to implement this technique? Well, like many safety-related issues, the most important thing is simply deciding to implement the policy. Like the old Nike slogan, just do it. Take the extra time to ask your patients about COVID and to ask about the common lingering symptoms if they've had the illness. Do a thorough assessment and do extra testing and obtain pre-op consultations where appropriate. Explain to the patient that recent COVID and anesthesia are simply a bad combination and that we need to do everything possible to make sure you're as safe as you can be for your procedure. Well, as we know, this is a rapidly changing area. New viral variants have popped up with disturbing frequency and terrible impacts. Omicron affects the airways differently than the Alpha or the Delta variants of COVID-19. And recommendations about timing of surgery after COVID may certainly change as new publications come out. In the absence of new data, though, we'd still recommend taking a cautious and prudent approach. Thank you.